Ligeia Ricciardi, the Chief Transformation Officer at Carium, here at CES 2020 in the Digital Health Live studio. And I am pleased to be doing an interview today with Dr. Stephen Falowski, who's a physician with NANS. Welcome, Stephen.
Well, thank you for having me.
So a little while ago, you were on the main stage in the Digital Health Summit. You want to tell us a little bit about what you were discussing?
Yeah, absolutely. So I'm a functional neurosurgeon. So what that means is I implant devices anywhere in the body, from the brain, the spinal cord, peripheral nerves. We also do wearable devices, external devices. These are all minimally invasive devices. Some of them as easy to implant as a needle poke, or like a flu shot. So what I'm here doing is representing NANS, the North American Neuromodulation Society, which is the biggest society that brings together medical device companies as well as physicians and patients to make them aware of these devices.
Yeah.
Some of the most common things we treat with these devices are chronic pain. We were here last year representing ourselves on behalf of the answer to the opioid crisis. These are minimally invasive devices that have extremely high success rates, some of the highest success rates we've ever seen in healthcare.
That's pretty amazing. What are, particularly if you've been at CES before, I'm interested in trends you're seeing. How are things different from last year, or maybe even more importantly from 5 years ago?
That's a great question. I can tell you in the way it relates to us is this idea of smart technology, connectivity. The idea that we're now using wearables to integrate with our implantable devices that can give us the idea of functional outcomes. How well are patients doing? Can patients now communicate with their device so that it's not so intrusive anymore?
Mm-hmm.
You know, a lot of our cutting edge technology was able to turn these into very small implantable devices the size of a quarter and make it very user friendly for the patient, but there was no connectivity with the patient. So now we're actually using wireless technology, linking it to iPhones, seeing how patients do long term, and we can tell them how their sleep is improving. They have less arousals at night. They're also walking more, less anxiety. You know, so a lot of these things is connecting and now using smart technology to connect our devices for patients in the real world.
Excellent. And assuming we're both back here a couple years from now at CES, what do you think are some of the main kind of trend directions that you'll hope to have realized, or that we as a community have realized by then?
Mm-hmm. Well, I can say I think our space of neuromodulation is exploding in healthcare. We're about a $7 billion space, and we continuously grow. And one of the things we're doing is we're expanding our indications. You know, we started for 50 years treating chronic pain, but we've moved on now to treat things like Parkinson's disease, tremor, incontinence, stroke. There's a lot of research now coming out for addiction, depression. Essentially, there's so many things that we can treat just by activating neurons and learning which nerves to treat in the body to treat almost any ailment in healthcare. So it's an exciting time for us.
That is super exciting. Thank you for sharing the latest with us, Stephen.
Okay. Thank you.
Again, we are in the Digital Health Live studio at CES 2020 in Las Vegas. Thank you.
Thank you.